When the transfer of the hospital from made to general to the hospital, I sat on the board in 1987 when I first came on council. So I understand what went on there. The concerns I have, and again, we don't want the acute hospital to pay for long-term care. I know that's two separate things. But what I was trying to do with Chantal Leclerc was to try to get some funding for long-term care beds and maybe have St. Joseph Villa continue on with these 32 beds as long as they're needed. I think it's important that Chantal did say that she is always open to partnerships. And I don't think I ever said that the hospital, acute care hospital, should be paying for long-term care beds. And I understand that. Mike?
I'm only interrupting you to make sure the public understands here and at home that Chantal is the
I'm sorry,
the chair of the board of the LHIN.
That's right, I'm sorry, yes. My only comment is, do we have any, you're closing all the facilities that are coming over to the hotel. Is there any one of these programs that are not going to be at the hotel, such as the addiction program?
The only program that is currently in building 1 and 2, one is St. Joe's piece, but that will be gone long before we know. And withdrawal management was actually in temporary quarters as well. That is a community program that used to exist in a building on 2nd Street.
Right.
And because of a number of issues that were happening with that building, we moved it into temporary relocation, which is the former ER in the former Cornell General site. And they typically withdrawal management would definitely not be in hospital, so it's not provided for within the hospital site.
But is that a change from the ministry's new way of looking at programs? Because if it was in there must have been a reason why it was there instead of being out in the private sector of the community.
It moved from, I'm thinking about 2007, because we had issues in the rental space before I was in, so we moved it temporarily to the former ER.
And I'm just wondering, is the hospital board open to partnership? Somebody come in and want to run some of these programs that Ms. Leclerc had talked about. They want to like to be in partnership. If they could access the funding to continue running those programs at that hospital, would the hospital board be in a position to lease it back to the people or sell it? What are we looking at?
Well, the hospital is obviously interested in partnerships, so we need to understand what that is. And I think that the greatest concern to the hospital board right now, which represents that corporation, is that we not end up with a liability.
And I understand that.
And that's, I guess that's really the bottom line. But and I tried to suggest in the presentation that, of course, there are no limits. Any group, council, or developer is encouraged to come forward.
Okay, so if somebody wants to continue on having some of the services that you're not having, like long-term care, if they could access the funding for that place, you'd be receptive to leasing the property back to these people?
I couldn't speak to the board on that. I know that the board would be receptive to selling it because that's why it's on the market.
The property's cheaper than the buy it too. My only concern that and I don't know why, I think that the public have a right to know. And I understand that, but what you've mentioned here tonight, and I know that the media is going to talk about it, but I think at a session that people could ask questions and basically know full well, and it's very, your presentation is very, very well done, but I think people are not seeing that. Maybe they just can't put two and two together why it would not be brought forward without having to be asked for it.
So when we talk about not intending to have community consultation, that's very different than having information. So obviously it would be very pleased to deliver this message anywhere.
But I think when I talk about consultation, I'm not talking about trying to make your decision for you, so I'm saying just let them know what you're doing.
We wouldn't want to give them this concession that there were options. That's That's the piece.
And again,
Perhaps, sorry, if I could add to the idea of you're asking for the board considering other options, and we also have a timing element. If you remember back when I introduced the whole topic, there is a timing element whereby, as Jeanette so aptly pointed out, that it goes from being an asset to something that's going to be a burden, and so we do have to move things, and as you know, our plans don't always meet with those we may partner with, so that's where we have to look at that.
but again, just to reaffirm, Chantal Leclerc, the CEO of the LINS, also indicated to us that these people would not be forced out of there. They would just have a place to go to. And I know you're saying they're not funding long-term beds, they're calling rehabilitation beds. Well, if you're not rehabilitated, then you're still not going to be able to go and foster care back home. So they're going to turn out, it's just another name they're putting to it for as far as I'm concerned, for a long-term bed.
But rehab is a program.
That's right.
And long-term care is a living arrangement, so they're very different in nature.
They're different nature, but you're not going to move out of there unless you're rehabilitated. So if you bring somebody into to rehabilitation and they got Alzheimer's and they're at the late stage of Alzheimer's, you're not going to rehabilitate them.
No, and that's not what the Assess and Restore was focused on, was Alzheimer's. It was more in terms of rehab for therapy. No, the Alzheimer's is a different, it's a condition. The therapy, the physiotherapy, is to improve a patient's ability to deal with their environment.
And I can understand, and some people come out of the hospital, that broke her wrist, come out of the hospital, you shipped her down to Bourget to die 3 weeks later. That's rehabilitation, that's shock. Coming out of their own community, not having anybody visit them. So that is not I understand long-term care is not your responsibility, but I can tell you the Ministry of Health has to take a look at this stuff. Because it's costing, every time you change a program, it's a home care program, there's an effect on municipalities' costs. We look at the mental health issue, a couple of years back where they made changes, and the service is not there today as it was back then. There's a report come out from London, $12 million it cost them on just for calls to Cops London, Ontario. $12 million in their 2000 budget and police budget. They respond. And I'm afraid that with this addiction program not going to be going back to home-based program, this is going to occur again. I think it's going to be additional costs to the services in our municipality, and that's a great concern. So I hope that you do have this my consultation or information meeting, whatever you want to do with the public. I think it's important to do that. And I appreciate your presentation here tonight, and thank you for coming.
Jeanette, you wish to say something on that?
I was just going to provide clarity on the current long-term care, but I don't know today's status. But for example, I know last week that St. Joseph's had only 3 patients still waiting for admission to long-term care. So we do expect that everyone will be appropriate in a facility of their choice by the time we get to the end.